Hi, I'm Nicole Turnbo. I'm a pediatric nurse practitioner, and this is my husband, Dr. Kyle Turnbo, and we are here today to talk to you about COVID vaccine in children. This Saturday, November 20th, from 9 to 3, we are holding a mass vaccination clinic at HealthWorks Medical. This is a collaboration among many of our physicians here in town, family medicine, pediatricians, and we are so excited to have this group effort and an opportunity for the parents for you to bring your children to a safe place. And it's going to be a fun atmosphere as well. We have superheroes and also I think a little guest visit from Santa Claus himself. So that is from 9 to 3 here at HealthWorks Medical. We are at 2331 New Holt Road. No appointment is needed. It is great if you can bring your insurance card. You can call ahead and pre-register if you want, 270-441-4777, but that really is not needed. Just show up. And I think it'll be a fun, safe experience for the kids because they are heroes for coming out to get their shots.
Absolutely. I think it's important to know that you do not have to be a patient of HealthWorks. This is open to everyone in the community. Our goal in collaboration with the other clinicians, pediatricians, and family doctors in the community is to just make a safe, fun environment where people can bring their children to get vaccinated by people who love children and who want to do the best they can for our community.
Great. So we're just going to kind of review quickly some facts, what we know about COVID in children, and then also go through what the studies are showing us with vaccinations. So what we know as of today, this was printed, I guess, last week, 1.9 million children have had COVID that are documented cases. And that's a lot. That's a lot of kids.
And that's in that age group.
In that age group,
11-year-olds.
yes. That's in between 5 to 11-year-olds.
That's really important because I think I hear that a lot that, children in that age group don't really get COVID very frequently, and that's just simply not the case. This evidence shows that nearly 2 million children have had COVID recently because a lot of those came with the Delta variant, which was much more aggressive in that age group. And the other thing that we don't know is how many children in that age group had the disease, but didn't actually come down with symptoms. So we're talking about 1.9 million children in that age group who actually were diagnosed with COVID-19.
Correct. And of those, we know that there were 8,300 children that were hospitalized, and of that, a third of them were in the ICU. So that's a lot of children in the ICU that were really sick with COVID. Of children ages 5 to 11, we have had 94 deaths. And of children under 18, we have had 800 deaths. And that's a lot, considering that is 4 times as many deaths as we have for influenza every year.
Right.
So, and when we also know that there are 2,000 documented cases of this MIS-C. Do you want to kind of explain what MIS-C is?
Yeah, it's multi-organ inflammatory syndrome in children. And what happens is, COVID itself, the virus is aggressive, but sometimes it induces the body's immune system to become hypersensitive or overactive, and that inflammatory response from the body's immune system can really affect multiple organs throughout children, and that leads to much more aggressive, much more serious disease that often requires hospitalization and intensive care unit cases. So I think the point of this conversation is that I know there are going to be people out there who think, COVID-19 doesn't really affect this population, and if it does affect them, it's not serious. I think the point of this facts is that that's not true. I mean, I think it was probably more true during the early days of the Wuhan variant, the UK variant, even the Brazilian variant did not have as many detrimental effects as certainly the Delta variant did. But you also have to consider what's to come, and we don't know that. Nobody can predict that future.
Right. So in looking into the study that was presented to the FDA to get emergency use authorization, they looked at about 3,000 children in the study, and then they added about 2,300 more. So we're looking at a good sampling of children. And then plus we had already given 11 million vaccines to kids ages 12 to 17. But so of those that received the vaccine in the study, only 3 kids got mild COVID. So that really shows us how effective this vaccine is. Okay. And then from the placebo group that did not receive the vaccine, 16 of those kids got COVID. So you might say, well, that's not a lot, but you never know. And with the multi-inflammatory disease and of those that have died, this can be a serious thing for children.
Well, it's a five-fold increase. So when
Right.
you're talking about a study group of around 5,000 children, the number itself doesn't seem like a lot, but it's a five-fold increase. And if you take in consideration the 1.9 million children through this latest waves were infected with COVID, a five-fold increase looks a lot more serious when you consider we do not yet know how virulent the next strains are coming. And if you think this disease is over, you are probably in for a rude awakening, because there's already additional variants headed our way from Europe, and it is almost certain that COVID-19 virus and its various mutations are going to be in our community for a long time to come.
So looking back to the study, of those that were immunized, there were no deaths, there were no hospitalizations, there were no cases of this MIS-C, and no myocarditis. And of the 3 that got COVID, they only had 2 symptoms, and that was a cough and a sore throat. Versus those in the placebo group that were sicker, they had 5 or more symptoms, including chronic fatigue, fever. They were just a lot sicker than the kids that then got the vaccine. So that's an important fact to know.
I think one of the most important things, and I hear this a lot from concerned parents about myocarditis or pericarditis, and certainly it is true that COVID-19, the actual disease itself, does increase your risk of getting myocarditis or pericarditis about 10-fold more than the actual vaccine. So are we saying that the COVID vaccine traditionally prior to this age group was not associated with myocarditis or pericarditis? No, it did increase it slightly, but those kids all recovered. So it is a potential complication from COVID-19 vaccination, but it is 10 times more likely to be a complication of getting COVID-19 itself. So, all of this, nothing in life is without risk.
Right.
So we have to make a determination of a risk-benefit analysis. And in this instance, taking your chances with not getting vaccinated increases your child's risk of myocarditis and pericarditis about 10-fold. So I think it's much, and when you put it that way, I think it's pretty clear that vaccine is the preferable way to go.
Right. So let's say you do decide to get your child vaccinated. This is what the study said about side effects, what you might expect. 73% had pain at the injection site, which I know we got ours, and
Sure.
yeah, our arm hurt. We will say that. So
It did.
73% of kids did. 39% had fatigue. 28% had a headache. 6% had fever. 9% had chills. And these symptoms only lasted 12 to 24 hours, and then they were fine after the vaccine.
I think those are common vaccine side effects from a lot of vaccines, but particularly the vaccines that are most effective tend to have a little bit more robust immune response. So I think it's reasonable to expect that your arm's likely to be sore. You may get a little fatigued for 12 to 24 hours. A little low-grade temperature is not uncommon. I think most parents know and accept that those are things that they see after they immunize their children. This is no different than that.
Right. So I know there's still a lot of question about how this mRNA vaccine works, and it seems new to people, and this was rushed. Can you kind of just sum up and tell us how this mRNA vaccine works and how it's different?
Sure, happy to do that. I think I'll try to make it as simplistic as possible. It's a little bit more complex, but in general, messenger RNA vaccines are not new. They were initially studied as vaccinations in 2000 and went through an FDA approval process then, and then again in 2005. But I think the easiest way to understand it is messenger RNA vaccines are like giving your body, your child's immune system, a coach that teaches it how to ward off or fend off any future infections from COVID-19. So let me explain that. Messenger RNAs are simply little post-it notes. They're like little messages, just like the name would indicate. They go to your child's cells, predominantly in the muscle cells where we inject it, and it just gives a message to that cell's factory that says, produce a protein. And the protein is the spike protein that's on the COVID-19 virus. I think most of us have seen the depiction of the COVID-19 virus with the little spikes all over it. What this messenger RNA does is simply give that body's natural immune mechanism something or some instructions on produce this protein. and then this protein activates your body's immune system to recognize that protein in the future and be ready to kill it should it ever come back around again. So, it's like anything. The more you practice and the better prepared you are, the better off your outcomes are going to be if you get into the game day situation. And in this instance, the game day situation is actually being exposed to COVID-19 virus.
Right. And we're going to attach a great little video that really does a great job. We watched it together, and I was like, this is really simple, and it helps you understand how the mRNA works. So we'll attach that to this video. So another question, we're still hearing this. Do mRNA vaccines change your DNA? Can you just clarify that?
Yeah, I can clarify by saying with 100% certainty,
Yes,
no,
does
absolutely not. It is scientifically impossible for messenger RNA to affect DNA. So just to give you a quick instance of that, your DNA sets in and is housed in the nucleus. It's sort of like the brain center of your cells. A messenger RNA is produced by DNA, and the DNA sends messages to the factory floor. That's a one-way street. Messenger RNA cannot get into the brain of the cell where the DNA is, and so therefore it's physically impossible for messenger RNA to somehow affect your DNA. So that's the best answer. The other thing is that messenger RNA is not very hardy, right? The original studies with messenger RNA, they weren't very successful because the body's natural immune system destroyed them before they could do their work. And then in 2005, when they wrapped it with a lipid nanoparticle, which is essentially butter, it was able to get into the cell and do its job. But these little Post-it notes, this messenger RNA, are so fragile that after they give the message to the factory floor, they disintegrate almost immediately, such that about 2 hours after we give a child or an adult a messenger RNA vaccine, all of the messenger RNA is actually degraded and gone. So it's just enough time to give that message to the factory floor of produce this protein, and then it's gone out of the body.
Right. So another question, this might seem silly. Will it make your child behave better to get the vaccine? Because I would take,
we've
had
already
people
vaccinated
our children.
rushing to the door to get that if it affected behavior. No, it should have no behavioral effect.
Okay.
I think there may be a little bit of a kickback initially with any vaccine, but
okay. All right. So the risk of severe disease is pretty low for children, right? We've talked about that. So why should you vaccinate your child?
Yeah.
Why should you do this? A lot of people, you may have been vaccinated yourself, but you're looking at your child going, I just don't know if I want to do this. So why is it important?
I can certainly empathize with that. I think one of the examples would be, your chances of your child being severely injured in a motor vehicle accident is actually pretty low. But it doesn't stop any of us from putting them in car seats and putting the seatbelt on and giving them that extra layer of protection against possible, ill effects or bad outcomes. So giving your child the vaccination for COVID is just another layer of protection. We just said that nearly 2 million children did have COVID-19, that we lost 800 children throughout this pandemic so far, 94 in this age group. That's not insignificant. So I think it's important. The other thing I think is important is it would sure be nice if we could predict the future, but I don't know anybody who is very good at predicting the future. We can't even predict the weather. For sure, we're not going to be able to predict what is going to come our way with the next strain. I think if we learned anything from June, when we thought COVID-19 has been defeated, COVID-19 is gone, people were taking their mask off, there was this whole sense, even from the adult population, of it's already gone, there's no need for me to get my vaccine. And lo and behold, we had the next surge of the Delta wave, which was worse than anything we had ever seen before. My point is, it is important to get your child's defense mechanisms up and running. Another example is we haven't seen a lot of polio lately, but it doesn't prevent us from immunizing our children against polio.
That's right.
And so, to my knowledge, there's only been one disease that's been eradicated, and that's smallpox.
Right.
And we still give vaccinations for childhood illnesses that historically killed 1.5 million children in the world. But we do that because we know that these viruses and bacteria are smart. They mutate, they come back around. And if your child's not protected when they come back around, there is no prediction and there's no good understanding of what that could lead to with the next round of virus.
Right. So another question we get a lot. My kid, I know they had COVID. They tested positive over the summer. Why should I vaccinate them? They have natural immunity.
Yeah, so it's the same reason that there's 2 vaccines in a series, right?
Right.
So the first message that you give your child produces antibodies, and those antibodies circulate around. But what it doesn't do a good job of is producing something called memory B and T cells. So the more you practice something, just like that coach, this messenger RNA is coaching you on this is what you need to be looking for. The more you practice it, the better memory you have, and the better the outcome is going to be. So it is critical that it is not adequate to just give the first vaccine in a series. The second vaccine is really what provides the memory. It's what activates the memory B cells and the memory T cells that gives you longer lasting, more robust immunity. And so that's the reason you should get 2. It's also the reason that if you've had the disease, that's not enough.
Right.
Getting the first in the series after having had the disease really gives you a lot of that B and T cell memory. The current recommendation is to complete both of those vaccine series because it doesn't hurt to get more robust B and T cell memories for long-term protection. We know from the adult studies that most natural immunity can start waning after 3 to 4 months, 90 days plus. After just natural immunity, and you don't seem to get that B and T cell memory like you would with the vaccination.
Okay, great. So I think we've answered a lot of questions, hopefully given you some good information, but we are so excited. I hope you bring your children this Saturday, November 20th from 9 to 3 to HealthWorks. We have an excited crew here to make it a happy, and we talked about this kids will remember this moment, getting their shots in a pandemic. So we have some Santa and some superheroes. They can get a great little photo opportunity to remember this event that they are heroes by getting their shot.
Getting your vaccine is really a heroic thing to do because it protects not only you, but it protects your friends and others at school. And so I know we are all hungry to remove the masks and to be able to go on about our lives. And I think getting this segment of the population immunized goes a long way to eradicating the need for some of this social distancing and masking that we're currently having to do. We will be having a second because it's important to get that second shot, so that'll work out to be December 11th.
December 11th from 9 to 3, again here at HealthWorks. And what's really cool about this is that we did the math. 2 weeks after December 11th is when you were fully vaccinated. And guess what day that is?
Christmas Day. What a great Christmas present.
It really is. So. I think it is. And what a great thing. And so we hope you come out. If you have any questions, call our office, 270-441-4777. Ask your local pediatrician, your health provider, if you have any other questions about vaccinating. But we're just excited for this great event.
We certainly are. The other thing I would say is that I want to thank the partner pediatricians and family doctors in town who are helping make this a possibility. And again, you do not have to be a patient of HealthWorks to get this vaccination, participate in this clinic. And if you don't get the vaccine here, please take your child somewhere. There are a number of sites available and get them vaccinated. We appreciate all your time.
Okay, thanks.